Good morning, everyone. It is May 21st, media briefing number 47 related to COVID-19. I'm Bob Ravenscroft, the Vice President for Advancement. I have with me today John Woodrich again, as usual, President and CEO of Bryan Medical Center. Just an announcement about tomorrow. We will have Dr. Kate Rosenberger. She's an otolaryngologist or an ear, nose, and throat specialist and a member of our surgical team. There's arguably no specialty that is more exposed than hers because of the aerosolizing nature of this disease and the viral load that comes from your nasal cavity and your mouth. So Dr. Kate will be here to share some processes that we put in place to ensure the safety of the staff, but more importantly, to explain why these measures are put in place for the safety of the patients. And basically what I'm alluding to here is some of the pre-testing that takes place before surgery. Lastly, before we give the stats, Memorial Day is right around the corner. Services, businesses are reopening. There are gatherings and temptations for all of us in the next couple of days. So I just implore you all to be safe. Wear your mask. Keep your hands germ-free. Socially distance. We all want to experience the things that we, did just a few short months ago, and we want our fellow citizens to flourish. So really asking people to wear a mask is really not that much, and it's so minor compared to the extreme isolation that we've endured over the past couple of months. So as Dr. Johnson said a few weeks ago, we've all done our part in flattening the curve. We've all sacrificed a great deal, and as we rebuild, we're strongly advocating for the universal masking. So please mask, encourage others to do so, and let's all band together so we can restart safely. Early on one of the state calls, they said one thing that would derail us would be apathy and ignorance, and let's not let apathy and ignorance stymie our collective ability to restart and so forth. We can't let our guard down carelessly. Our midnight census was 435, so continuing to tick up a little bit. We have now administered 8,046 tests here at Bryan. Positives took a jump yesterday. We're up to 1,067 positive results, and we have 377 pending. John will get into the pending that occurred at the drive-through. Big numbers continue to come at the drive-through, so there's still a lot of people not feeling well. That's where you get a doctor's order. So, it's people not feeling well with the doctor's order and still a high number of people being tested under those parameters. So with that, I'll give it to John, and then we're here to answer any questions.
Thanks, Bob. And as he talked about our pending numbers, we're still looking at about a 2-day turnaround from our third-party lab, so we're very pleased with that after seeing some backlog the previous week. We currently have 26 positive COVID patients in-house. 17 of those individuals are Lancaster County residents and 9 are from outside of the county. Still have 10 individuals on ventilators, 6 from Lancaster County, 4 from outside of our county. We have 10 individuals in our intensive care unit, 7 in our progressive care unit, and 9 in our general care unit. We talked a little bit yesterday about our mobile unit. It looks like we're going to probably be waiting another week to do our mobile for the cultural center. We believe that we'll probably do that at the Lincoln High School again. Those arrangements are still being made. And as we've been sharing with you, our elective surgeries, as we've moved into phase 2, things seem to be going very well with that. We're in good shape from that perspective, and we will be doing an assessment next week on if we will move into stage 3 of our elective surgeries. With that, we will just open it up to any questions via chat.
I know it's a concern of the staff over there, just as the stress and the anxiety and all of the emotions that come with this prolonged period where, people have been locked down for a long time, and we're going to be in this kind of maintenance phase, as we articulated, earlier this week, until there's a vaccine. So I know they're acutely aware of that, and we're certainly cognizant of that for our own employees as well with our EAP programs. Not suggesting we've seen increased traffic, but making sure those resources are available. And as Dr. Myers has said in past ones, we're there for folks. And they're still seeing people, and they're seeing a lot of things. So anyway, we'll find out if the mental health traffic through the ED has increased, and get back to you if it has gone up or down.
We continue to work with the blood bank, and I think you'll be seeing some more information about drives being held. We're not in a critical stage from the blood supply, but just knowing as these surgeries continue to ramp up, we need to make sure that people have the capability to continue to donate blood, and they're trying to do that in the most efficient and safe manner that they can for the future.